Next, I invite Dr. A. Anjani to present on a clinical study of role of VEP in optic neuritis patients.
Good morning, everyone. I am Dr. Anjani, second year postgraduate from AMC Visakhapatnam. Today I am going to present a clinical study on the role of visual evoked potential in the optic neuritis patients. Financial disclosure, no conflict of interest. Introduction: optic neuritis is an inflammation of optic nerve due to primary demyelinating process, mainly multiple sclerosis, and it is secondary to other causes like autoimmune infections or idiopathic. And this inflammatory process mainly causes the degradation of myelin and destruction, leading to poor conduction of impulses by the axons, and most commonly seen in around young females around 18 to 42 years, and mainly characterized by sudden loss of vision, field defects, relative afferent pupillary defect, and decreased color vision. And visual evoked potential, it measures the electric signals produced in the brain in response to stimulation of retina. It depends upon integrity of visual pathway. Here the pattern reversal is recommended because in addition to inter and intra-individual, variability is minimal compared to no pattern stimulus and detects the minor visual pathway abnormalities with a better accuracy. It is recorded using 3 electrodes placed in occipital region with a mid-frontal reference electrodes. And signal on mid-occipital electrode has a prominent positive component called P100, which is preceded by N75 negative wave. An elongation of P100 wave latency reveals the number of demyelination and amplitude related to axonal degradation. These are some of the patients with optic neuritis fundus pictures. And aims and objectives: to study the role of VEP in optic neuritis patient and determine the characteristics of VEP in them. Materials and method: this is a descriptive cross-sectional study done in optic neuritis patient in Department of Ophthalmology, Tertiary Eye Care Hospital from Jan 2023 to June 2023. And inclusion: 50 optic neuritis patient attending the ophthalmology OPD and neurology OPD clinically diagnosed as optic neuritis included in the study. And exclusion: patient with other known history of glaucomatous optic neuropathy and other optic nerve and retinal disorders are excluded. Patients aged from 15 to 79 years, both sexes were considered and subjected to detailed history. Visual acuity is measured, RAPD examination done by swinging flashlight test, and color vision tested by isochromatic Ishihara chart, fundoscopy done using direct indirect ophthalmoscopy, and VEP done using pattern reversal technique, and the readings are noted. Results: out of 50 patients, we found that 58% are found to be females and 42% are males. And age-wise distribution: population divided into 6 groups and majority lies in between 36 to 50 years, that is 46%, followed by 51 to 65 years, that is 24.6%. The same depicted in the graph. And in VEP recordings, the mean latency waves, that is N75, positive P100 wave and negative 145 and amplitude were considered, and following results were obtained. In increased P100 latency and reduced amplitudes were found in majority of the cases, that is around 62%, and normal latency and reduced amplitude around 22%, and both the amplitude and latency are found to be normal in around 16% individuals. These are some of the recordings. Based on the recordings of the VEP findings, that is majority of patients have both optic nerve lesion, that is 45.20%, and followed by the left eye lesion, that is 24.80, and 13.10 is right eye, and normal is found in around 16.70%. Based on above results, most of subjects are young adults, typically ranging between 36 to 50 years, and the mean age is around 38.4 years. According to results, majority have a prolonged latency and reduced amplitude, that is around 62%, and 16% individuals having normal VEP values. In this study, it is also concluded that dominant VEP of optic nerve lesions were both right and left, that is around 45.2%, and in acute and the acute optic neuritis patients with a normal VEP findings are around 16.7%. These are some of the studies that are correlated with my study. Conclusion: based on our study, we noted that majority were young adults and there is female preponderance, and characteristics were prolonged P100 latency with a low amplitudes and showed predominantly both the left and right optic nerve lesions. In optic neuritis, the P100 waveform is found to be the most informative index, where VEP plays a key diagnostic role, but along with the other optic nerve function tests in detection of optic neuritis, it is a sensitive diagnostic tool, but it is not specific. These are my references. Thank you.
VEP is not a diagnostic tool for the optic neuritis because it has no localizing value. And second thing is, you have not mentioned about the refractive status of all these patients. And what was the refractive status of the patients and what was the corrections were given, and those things you have to mention about it. Otherwise, there is no point in saying that VEP is correct or not. If I don't see properly the checkerboard, I get a low value. And if I see checkerboard correctly, I may get a better value. So you have to mention about that. That you have not at all even suggested in there. So that requires some correction.
Yeah, that's important. We have to provide the reflective difference in the latency between two eyes in any patients where it was unilateral disease, like right eye was affected versus left eye was normal? Was there a difference in the latency of
Yes,
these
sir.
patients?
Interocular latency
So,
differences.
did you can also add that also to the, yeah, this is well known. What you have presented is very well known in the literature. Majority of the patients have these findings, but as sir said, it is not the only diagnostic tool. We can use it as supportive evidence.
Yes.
Thank you.
So any correlation with the RAPD? You say 16% have normal VEP.
No,
So how
sir.
do you really diagnose as a confirmatory thing for patients with that?
Actually,
If the
they were
optic nerve is looking fine, how do you really make a diagnosis?
means I didn't compare with RAPD, sir. Generally, I have mentioned only VEP normal patients. Means some of them is also having normal because they have already received treatment in of the neurology department, sir. So they may have normal VEP values, sir. So they are referred from there. So I got the normal.
They may not have a normal VEP because VEP almost
for
never
some
normalizes classically in a patient with optic neuritis. Up to 80% of patients will have persistent change lifelong.
yes.
So it should not normalize in a very short span of time, even the amplitude should not recover. But sir's question is how you diagnose these patients as optic neuritis. So they were diagnosed based on clinical and
Clinical
radiological findings, I
radiology.
believe.
Yes.
VEP has a very good tool to evaluate the recurrent optic neuritis patient. Suppose you have already documented several times, they have recorded well about the previous status of the VEP, you know, and if you carefully follow them, anything minor changes, you can easily identify them when the other causes are not there. In the sense there are no other media problem, no other thing. Definitely you can say a recurrent attacks of that. It is going to be a useful tool to diagnose, or at least know how much is the problem, how much we are recovering. These things we can identify by that. Otherwise, as such per se, it is not a diagnostic, but it is only to identify you certain features.